Welcome to Field Notes, Insights from N2PH Health Alumni. N2PH Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, N2PH Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Luca Hicks, Community Health Promotion Specialist with Barry-Eaton District Health Department in Michigan. Luca graduated from N2PH Health in January 2024. Luca, tell us more about your background and your journey into public health.
Yeah, thanks, Juliana. I really appreciate the time getting the time to chat a little bit about the work that I've been doing at Bedhead. First, I was born and raised in the Detroit suburbs, so I've been in the mitten for most of my life. Spent my undergraduate years at Michigan State, go green, and I studied neuroscience and really had it in my head that I was going to be a doctor one day. But I had some experiences at Michigan State, specifically in their alternative break program. They kind of focus on social issues across the country, and that really showed me that I wanted to get out and see more than I had so far growing up in Michigan. I'd only ever left the state once before college, and that was a high school physics field trip to Cedar Point in Ohio. So when I went to Michigan State and joined ASB, we went on trips to New York City, Kentucky, and Jamaica that each kind of led me to looking at other opportunities to learn about places beyond my community, which ended up leading me towards the Peace Corps. After graduation with my undergrad degree, I ended up spending 2 years living and working in Benin out in West Africa, focusing on rural community health work. I learned French, I learned local language Aja, focused in on public health efforts, including nutrition education, malaria prevention, gender equity, a broad array of things that really kind of convinced me to switch gears from the medical path and start pursuing my MPH instead. After I got home from the Peace Corps, back to Michigan, I ended up spending another 2 years in Tampa, down in Florida, focused on maternal and child health, and got my MPH, and then came back to Michigan again. So made it back here to join the Barry-Eaton District Health Department a couple years back. My first position was as a liaison with some of the school districts in our two counties. That's actually when I entered the N2PH program. I entered that program with one of the higher ups in my health department, which gave me a really cool opportunity to work on a quality improvement plan alongside her. That ended up highlighting some really strong components of both our administrative and our service delivery processes here at the health department. But it also laid the groundwork for the projects that I'd be taking on now in my current role. I'm a community health promotion specialist, like you mentioned, and I've been in this role about 4 months now. And when I first joined, we were actually in the midst of a couple different staffing changes that really opened me up to several new projects that I wasn't anticipating. One of which is our community health assessment and improvement plan across both of our counties, our CHA-CHIP cycle, for both of the counties that we serve in our district, actually.
Thanks, Luca, and thank you for your service in the Peace Corps in such a variety of areas as well. I know that sounds like it was very rewarding work, and I would love to hear more about that one day. So I'm sure you had really great experiences in the variety of areas you were in. But focusing on that work that you're doing now in your new role, and congratulations in that new role in the last 4 months as well. Tell us a little bit more about what you're doing in the CHA-CHIP, and I understand you're kind of in the middle of it. So is there anything that you specifically are proud of or something that you didn't expect that you want to share with us today?
Yeah, this is the first exposure I ever had to the CHA-CHIP cycle at all, and I jumped in right in the middle of both of our counties' processes. So I've been learning a lot of kind of the maybe more boring behind the scenes work, the data collection, data analysis. But when it comes down to it, the most important thing that I've pulled from this experience so far has been just interacting with community members face to face. A really strong community health assessment, which is first of all required by local health departments and the hospital systems that we work with, based on our two accrediting bodies. But more than it just being a required process that we do every 3 to 5 years, it's really crucial to understanding the health status of all the community members that we serve. We send out surveys, we conduct focus groups, we hold one-on-one interviews with leadership stakeholders at various community organizations in the area. And we really get people's stories from the ground to make sure that we are dedicating our resources in a way that is actually going to help the people that we serve. My role as kind of the lead on this project has encompassed several different things from, like I said, data collection and analysis, but I participated in these focus groups and sat with community members as they talked about some really tough experiences that they've had trying to access healthcare without insurance or enough insurance, trying to find safe and affordable housing in an area and honestly a country that really struggles to meet that need. Trying to find substance use disorder treatment as well, while juggling keeping a family and trying to keep their job. And you read those stories in the paper, or I guess more these days online, and you do have that empathy for these folks. But once you sit down and you have faces and voices and names to put to these stories, it really kind of puts into perspective the work that you do in the back end. You can put together a 150-page CHOW report, sure, but what does that actually mean? And getting these stories from people, trying to direct community organizations over the next couple of years to meeting the needs that the community members themselves are reporting, that's everything in a field like public health that can be pretty tough. But talking to just human beings and realizing what the work is about, it's been everything.
That is so true. That lived experience is so strong, and I want to say even stronger than some of that traditional data that we have that you alluded to in the report. So I can imagine how that being part of those focus groups and hearing those stories really helps bring it together, and then has that need and gives you that ability to highlight some of those stories and needs that are important to people. And like you said, to leverage then the collaboration with other community organizations to come together and do the great work of public health. So thank you for sharing your experience. Any final thoughts that you have, or advice for others, maybe beginning the CHA chip or haven't quite included focus groups, or any tips for finding the people in those spaces where people already are to be even able to share their stories with you?
Yeah, I mean, you kind of touch on it immediately with that is meeting people where they're at. And that's kind of the main tenet that I've taken away from my time in the Peace Corps. And I kind of thought like this is really good if we're working internationally with a population you've never had exposure to. You don't speak the same language. You meet them where they're at. You don't come into a new country and say, I know best. I know what you need to do to be healthy or to live a better life. So do what I say. You learn from them, you figure out where their culture stands from, where their beliefs and ideals come from. And that is the exact same process working in your own backyard or in a county next door where people, might look like you, but have wildly different experiences. So meeting people where they're at is absolutely the most important. And when you come from a health department in a time where not many people really like their health departments, bringing that human face to it, bringing yourself authentically and genuinely and saying, we both want the same thing. We want for you and your children and me and my children to be healthy. How do we get there? And that kind of makes all the difficulty not go away right away, but it makes it easier to handle.
Very well said, Luca. Well, thank you for all of the work that you're doing, the service to your community at home in Michigan, and for being with us on the podcast today.
Thanks, Juliana. I appreciate it.
Thank you for listening to Field Notes, Insights from N2PH Health Alumni. For more information, visit new2publichealth.wisc.edu.